In the part 2 of Cementum, we are going to continue with the classification. As you know, the formation of Cementum occurs in increments, and there are cells which get entrapped in between. So on the basis of this, we have classified Cementum into two major categories. First is the acellular Cementum and second is the cellular Cementum. As you can see here in the picture below, there is acellular Cementum here, and this is the cellular Cementum. Now in the acellular Cementum, no cementocytes are present and the deposition rate is slower. This forms first, it is first to form, and it is also known as primary Cementum. The width of acellular Cementum is more or less constant, and it is usually found near the cervical third of the tooth. Now coming to the cellular Cementum, as you can see here, there is a presence of cementocytes here. The deposition rate is faster and it is formed after the acellular Cementum. It is also known as the secondary Cementum, and its width can be highly variable, and it is mainly seen towards the apical region of the tooth. Now there is another classification in which we have categorized Cementum into 5 different categories, and the categories are divided as per the names. First is acellular afibrillar Cementum. That means there are no cells or no fibers present, and this includes for all that in the second there will be no cells but extrinsic fibers. In third there will be no cells but intrinsic fibers. Then here cells will be present and mixed fibers will be present, and in the last category cells will be present and intrinsic fibers will be present. Now there are two terminologies here. One is intrinsic fibers and one is extrinsic fibers. Now when Cementum is formed, collagen fibers are deposited and then they mineralize to form the Cementum. Now these internal fibers are known as intrinsic fibers. There are other fibers. Here supposedly is the bone and this is the Cementum. There are fibers which are present here. These are known as the periodontal ligament fibers. These are attached to bone on one end and are embedded in the Cementum on the other side. So these get attached while the Cementum is not mineralized. That is when cementoid is formed, and then mineralization occurs and they get embedded within the Cementum. Now these fibers form the extrinsic fibers, and they are also known as Sharp's fibers. Now coming to the junctions, the Cementum shows junctions with dentine, that is known as cemento-dentinal junction. It is a scallop junction where you have dentine here and the upper part will be Cementum. Now there is another junction that is known as cemento-enamel junction, and it is basically characterized into 3 different categories, as you can see in the picture here. So this is cemento-enamel junction. So the upper part here represents the enamel and this is the Cementum. Now first is this junction. This is a sharp junction or a bud type junction. In this junction you can see there is the contact of the enamel and Cementum at just one point. So this is a sharp or a bud type junction, and when there is no contact between the enamel and the Cementum, then it is known as a gap junction. And whenever there is an overlap of enamel over the cementum or cementum over the enamel, then it is known as an overlap junction. Now in case of overlap junction, there are two types. One is the cementum may overlap the enamel or the enamel may overlap the cementum. But the most common type is cementum overlapping the enamel. That is the most common type. And the enamel overlapping the cementum is least found, less than 1%. Now coming to the functions of cementum, there are three basic functions. First is anchorage, second is adaptation, and third is repair. Now what do you mean by anchorage? So if basically you have a tooth here, it remains in its socket due to the periodontal ligament. Now the attachment to the periodontal ligament, the attachment of the periodontal ligament is on one side to the bone and on the other side it is to the cementum here. So cementum provides anchorage here, anchorage to the tooth, and it attaches it to its socket. Now second is adaptation. Now what is the adaptation? So if you have a tooth here and due to excessive masticatory forces, the upper part of the enamel or the tooth gets decreased, then what happens is there is an addition formation of the cementum here which will maintain it in its socket. Now third is repair. As compared to enamel, cementum is a tissue that can repair itself. The enamel cannot repair as the cells are lost, but here the cells are present, so it has a function of repair also. There are two types of repair. One is known as functional repair, and another is known as anatomical repair. Now what is the difference between the two? For example, you have a shape like this and it gets broken on one side, and then what you do, it gets broken on one side and then you repair it like this. It will still serve the function of a block, but its shape has changed now. So this is known as functional repair, so that function remains the same. Now what is anatomical repair? So if you had a box here and it gets damaged a little bit here, and you repair it and it gets repaired so that it serves the function also and its anatomy comes back as it was before. That is anatomical repair. So in the case of cementum, we see both types of repairs, anatomical and functional repair. So if there is a minor trauma over here, then the cementum replaces it with a new tissue and maintains the anatomy. So it is anatomical repair. If the damage is more, the cementum will be deposited more on that side, and then it serves as functional repair. Now coming to the clinical considerations, there are various anomalies related to cementum. First is concrescence. Now what is basically concrescence is, if there are two teeth which get attached to each other with the help of cementum. There is a cementum in between the two teeth. So this is known as concrescence. Second is presence of cementicles. If this is the cementum and this is the bone, you have periodontal ligament here, and few cemental like tissue are found in the periodontal ligament, then they are known as cementicles. Then is another anomaly, that is ankylosis. So if you have a tooth here and here you have a socket, in some cases what happens, the tooth enamel is directly attached to the bone and there is no periodontal ligament like here attached in between. So this is known as ankylosis. Now coming to the last anomaly, it is hypercementosis. Hypercementosis is basically the excessive deposition of cementum. It usually is seen in the apical regions. So this is the hypercementosis. Now there are various tumors which are associated with cementum. These are cementoma or cementoblastoma and cementifying fibroma. So this concludes with the chapter cementum.